1 in 5 people will develop a skin cancer in the course of their lifetime. More than 3.5 million skin cancers are diagnosed every single year. This is more than lung, prostate, breast, and colon cancers combined. Unfortunately, not many people know the risks of skin cancer or even what to look for. I've used the American Academy of Dermatology, the American Osteopathic College of Dermatology, and the Skin Cancer Foundation for some of my research. I have also used a journal written by a nurse who specializes in dermatology. I'm a medical assistant for a dermatologist in Kansas City. We see on average 50 to 70 patients a day, except for surgery days, where we surgically remove skin cancer. Skin cancer is the most common cancer in the United States, but by educating yourself and using proper protection, you can drastically decrease your chance of ever getting it. There are different types of skin cancer. The most common form is basal cell carcinoma, or BCC. An estimated 2.8 million people are diagnosed annually in the U.S. alone. They are rarely fatal, but can be highly disfiguring if allowed to grow. The second most common form is squamous cell carcinoma, or SCC. An estimated 700,000 cases of SCC are diagnosed each year in the United States. If it goes undiagnosed and untreated, it can become fatal. Both of these skin cancers can be wounds that do not heal, new lesions, or moles that have been getting bigger or changing. Last, we'll talk about malignant melanoma. One person dies every hour from malignant melanoma. It is on the rise. Here's a graph showing the steady incline from 1975 to 2010. Melanoma is the most common form of skin cancer for young adults ages 25 to 29 years old. It can present itself anywhere on the body. I've seen it on backs, arms, scalps, and even the bottom of feet. If allowed to grow, melanoma can spread, and it can spread very quickly. When it does, it can be fatal. Now that we have talked about some of the different types of skin cancer, let us take a look at how they are treated. They can be treated in a number of different ways. Early skin cancers can have a less invasive treatment. There are topical creams that can be used. The doctor can perform cryosurgery, or in other words, they can freeze the lesion. For other skin cancers, the treatment may not be so easy. Skin cancers may need to be excised. The patients will have to go under a surgery, usually awake, where the doctor excises the skin cancer. Majority of the time, the patient will have sutures for up to 2 weeks, which requires daily changes of the bandage and limited activity. For skin cancers that have spread or metastasized, more treatment is necessary. Treatment can come in the form of radiation, just like with other skin cancers in the body. While incidences of skin cancer are growing, there are ways to protect yourself and prevent further damage from happening. Protecting yourself lowers your chance of skin cancer. About 90% of non-melanoma skin cancers and 65% of melanomas are associated with UV exposure from the sun. There are a few different ways to lower the amount of UV light that comes in contact with your skin. First, refrain from going outside when the UV index is at its highest. There's an app you can download on your smartphone called EcoSport Sun Protection where you can enter your location and it will tell you what the UV index is right at that moment. The UV index is how strong the sun's rays are. It will also tell you in how many minutes it will take for you to be in the sun before damage starts occurring. Usually it is right around 15 minutes. Next, wear sun protective clothing. Clothing is our first line of defense against sun exposure. Wide-brimmed hats and sunglasses are a good way to protect your face and ears from the sun. They make sun protective clothing that is specifically designed to block the UV rays from the sun. Next, wear sunscreen. A sunscreen with an SPF 30 or higher is preferred. People should wear daily sunscreen on the face and arms. Normally, they do not realize that even if they work inside, they are still receiving sun exposure. For instance, say you drive 30 minutes to work and back. Your car doesn't protect you from the sun, so that is 1 hour a day of UV exposure. Remember, it only takes about 15 minutes for damage to start occurring. Even if it is cloudy out, you should still wear sunscreen. Up to 40% of the sun's UV rays still reach the ground on a cloudy day. Most people do not apply enough sunscreen when they do go outside for extended periods of time. Sunscreen should be applied 20 minutes prior to sun exposure to allow the sunscreen to be absorbed. You should use about 1 ounce or 1 shot glass full of sunscreen, and it should be reapplied every 2 hours. Next, get yearly skin exams. Dermatologists know what they are looking for. With yearly skin exams, it is likely that a skin cancer will be caught early and treated early. Know the signs of skin cancer. An easy way to determine if something should be looked at is to remember A, B, C, and D. A is for asymmetrical, meaning one half doesn't look exactly like the other. B is for borders. Are the borders defined? Are they irregular? C is for colors. Are there different colors of black, brown, or red? D is for diameter. Is it bigger than the eraser of a pencil? And E is for evolving. Is it changing in size, shape, or color? If you tan, either indoors or outdoors, you should probably stop. Tans are caused by harmful UV radiation from the sun or tanning lamps. And if you have one, you've sustained skin cell damage already. Indoor ultraviolet tanners are 74% more likely to develop a melanoma than those who have never tanned indoors. All of these simple actions will dramatically decrease your risk of ever developing a skin cancer. Skin cancer is on the rise in the United States, whether it is basal cell, squamous cell, or malignant melanoma. Skin cancers can be treated many different ways, whether it is by freezing the skin cancer or removing it surgically. It can be easy to prevent skin cancer. Remember to wear your daily sunscreen and sunglasses. Also, when out in the sun for extended periods of time, wear some protective clothing and enough sunscreen to cover all of your exposed skin. Perhaps with enough education, we can stop the increase of skin cancer and help protect our future generations.